Hello guys, welcome back to my YouTube channel. This video is about Vitellointestinal duct anomalies, but more specifically Meckel's diverticulum. So before going to the anomalies, normally क्या होता है is after the folding of the embryo, you get your gut tube, somewhat like that, which is connected to your definitive yolk sac by a duct. This is called as the Vitellointestinal duct, also called as the ophalomesenteric duct. So normally this is supposed to disappear or regress, and it's no longer resistant, and it has to close both the sides, but it can either be present completely or a little towards the intestine, forming a diverticula, or towards the umbilicus, causing a sinus, and all of that. Agar everything goes normally, then you'll have your abdominal wall with your umbilicus and your intestines normal. Otherwise, there'll be some kind of connection or sinus or cyst, a lot of other things. So we're gonna go into that. So I'm going to discuss Meckel diverticulum in detail at the last. Before that, we'll do all the other types which we can see here. So this is the first thing, that the whole Vitellointestinal duct is patent, and this duct is present connecting the terminal ileum. So mostly we see fecal matter there. So that's why this is called as the fecal fistula, because fecal matter can come out through the umbilicus. That is the first thing. The whole thing is patent. Or it could be only open near the umbilicus, like a sinus inside your body. That's why this is called as the umbilical sinus. Okay, when that happens on this side, then we call it a diverticula, which is Meckel's diverticulum. Other thing that can happen is cyst can be formed. The cyst can be near the abdominal wall, or it can be intestinal wall के पास, or it can be embedded in the abdominal wall. Different places possible. Another thing possible क्या है कि where the Vitellointestinal duct was attached, it could leave the gut in such a way that there is stenosis of the gut. So that is also seen. Other thing is the remnants of the duct can form growths, or there could be fibrous cords instead of Vitellointestinal duct that can lead to fatal consequences like volvulus and strangulation of intestines, all of that. Or the cord only. Okay, so all of those things. Now I think we've discussed everything that's there to be discussed. So occasionally whole of the duct or its distal part may be patent. So former is fecal fistula, latter is umbilical sinus, may be represented by cysts. They are called as Vitelline cysts or enterocystomas, or there could be fibrous cords which are dangerous, and also growths can be there. So now talking about Meckel's diverticulum, and why is it so important is because it's the most common congenital anomaly, not the most common Vitellointestinal duct anomaly. It's the most common congenital anomaly we see in babies. That's why it's important. So what exactly is that? Is a true diverticulum. What, in the sense, all the layers of the intestine are basically bending and forming this diverticula. First point is that true diverticulum. What can happen is sometimes, because all of the growth is happening together, some anomaly can lead to the growth of pancreatic tissue or gastric mucosal tissue inside of this Meckel's diverticulum. So what that will be is a normal tissue like pancreatic or gastric is growing at an abnormal site, which is Meckel's diverticulum. That is called as Choristoma. So just wanted to add that. So that we see in Meckel's diverticulum, and also gastric mucosa will release H plus, and that can cause a gastric ulcer in the Meckel's diverticulums. That's very complicated. So that is there. What also happens is pain. So this is near terminal ileum, right? So it is very close to by the appendixes. So this pain cannot be differentiated from appendicitis. So mostly the differential diagnosis comes out to be appendicitis because the pain is the same area. Okay. So what is to locate it exactly? This Meckel's diverticulum is 2 feet from the ileocecal junction, which is here. So that is also there. So let's see what else is there here. So small persistent part seen along the antemesenteric border of the ileum, 2% of the people. So we'll go to the rule of 2 in some time. So It is of surgical importance as it may undergo inflammation giving rise to symptoms similar to those of appendicitis, and we discussed this also. So yep, now we go to the first aid, whatever is written. So it's a true diverticulum. Persistence of the vitelline or omphallomesenteric duct may contain ectopic acid secreting gastric mucosa, or it can contain pancreatic tissue. Most common congenital anomaly of the GI tract. So I failed to mention GI tract. Most common congenital anomaly of the GI tract can cause hematochezia or melena. So what these are is basically blood in the stools. Melena is clotted dark blood, whereas hematochezia is like fresh blood. So obviously if there is ulceration and everything, you'll obviously see blood in the stools, but mostly you see fresh blood, not clotted blood. So melena is less common. So right lower quadrant pain in the abdomen similar to appendicitis, and other things like obstruction near terminal ileum, obvious interception, volvulus, obvious. So this is all of the stuff. Diagnosis, I'm not read yet, so I have no idea, but for now I'm gonna remember it's called a Meckel scan and tectinium pertecnate scan. That's all for now. So now coming to the rule of twos. So it's commonly present in the first 2 years of life. So congenital disorders, obviously as soon as you're born. So first 2 years of life, 2% of the population, that too 2 times as likely in males. So किस में होता है, मतलब first 2 years of life, 2% of the population, 2 times as likely in males. Then as I said, 2 feet from the ileocecal valve, that is the exact location. 2 inches long. So here we are getting 2 centimeter and I'm getting 2 inches. We're gonna go with first aid for now. So that is the rule of twos, making it easy for you to remember all the points that are there about Meckel's diverticulum. 2 inches long, 2 feet from the ileocecal valve, and then obviously already discussed 2 types of epithelia can be there, gastric or pancreatic can also be there. And then first 2 years of life, 2% of population and 2 times as likely in male. So that's all for this video. I hope you found it useful and I'll see you in the next one. Bye.